So in this short video, we're going to talk about when you need to actually worry about your low back pain. What are the situations, what are the signs and symptoms that are going to point you in the direction of potentially something more scary going on, and when you actually need to go get checked out. But remember, this is only 1% of causes of low back pain. Chances are good that you're going to be just fine. However, let's get into it. Here we go. Here are those two situations that I think are medical emergencies. You really should get looked at right away. So please don't delay if anything like this is happening to you and you have low back pain. So first, if you have back pain that also involves pain in both legs and also weakness in both legs, so difficulty rising out of a chair, difficulty walking, difficulty standing, and then you also notice that it's difficult to go to the washroom. So it's difficult to pee, or you have more urgency in your bowels. This is a medical emergency and something that you really need to get looked at ASAP. Don't delay. The second situation is that you get back pain that resulted from any kind of accident or any situation that imposed forces on your back that were sufficient to cause a fracture. So think car accidents, especially when the car flipped, diving into a swimming pool and hitting your head, falling from a height, like think skiing accidents, or anything that involves like a serious force on your body that you aren't really prepared for. So I think in this situation, it's also a medical emergency. You really should get an x-ray and just go get looked at just to be sure. So those are the two situations, again, where you really should just get looked at right away. Don't think about it. Go get checked. It's better to be safe than sorry. Next, I want to talk about 3 big signs that when taken collectively, you should investigate for a more ominous cause of low back pain. Again, it doesn't necessarily mean that anything bad's going on. It just means that if these 3 things are happening all at once, it's time to be alert, time to get looked at, and time to go do something about it, and you shouldn't wait anymore. So those 3 signs are, 1, your back pain's been going on for more than 6 to 8 weeks. 2, it's severe, it stays severe, it's not improving, or it's getting worse with time. And then 3, you have 1 or more red flag present. Now, red flags are signs or symptoms that something might be going on that's more serious to your spine. However, just because they're present, it doesn't mean that anything necessarily is going on. And in fact, a lot of causes of low back pain that are more serious can fly under the radar without the presence of these signs or symptoms. But in the next slide, I'm going to list out all the red flags that you need to be alert to with regards to low back pain. So pause the screen, have a look, and determine if you have any of these. So again, it's only when these 3 big signs are happening all together that you need to be alert and investigate. It's not a medical emergency, but if they're present all at once, it's definitely time to go get it checked out and actually have a professional look at your low back pain. So there you have it, team. Super short and to the point, but those are the situations, signs, and symptoms that are going to point you in the direction of needing to get your low back pain checked out. Remember, only 1% of causes of low back pain are related to something scary, like cancer or a fracture or an infection or something else weird that's life-threatening. Only 1%. So if you have a new episode of low back pain, chances are you're going to be just fine. Almost all of us are going to get low back pain at some point in our lives. It's like the common cold of pain. So if you have it, don't panic, but now you know when you should get checked out. For more details, or if you want to know more about where I pulled information, I got a lot of this from a blog from science writer Paul Ingraham from painscience.com in his blog titled When to Worry About Your Low Back Pain. I'll put a link in the video description below so you can read that full blog and get all the details you need. Anyways, team, if you have low back pain, don't worry, don't panic. If you have any questions, reach out to me. I got your back.